Hello, Dr. Lim.
Hello, thank you for having me around today.
Of all the expertise, right, why did you personally choose orthopedic?
Well, orthopedic is a very interesting specialist for the doctor, especially for guys, because there's a lot of carpentry involved, a lot of using power tools, power saws, and a lot of guys actually
we are like your cabinets, huh?
Actually, when I was younger, I did have a fracture, so I was really impressed by the doctor when they actually fixed my fracture. It really helped a lot because after that I could return to sports and then soccer and football.
Oh, okay. So introduce your doctor to me, lah. Or have you learned from him already?
I've learned from him already, so I'll introduce myself to you.
Let's take on some questions very quickly. Mylene says that I have stiff joints on one side of my hip and was told that I may need hip replacement surgery eventually. What can I do to prolong or avoid hip replacement surgery? Thank you, Mylene. Over to you, Dr. Lim.
Yes, Mylene, that's a good question. So you're stiff on one side. I mean, by the time you develop stiffness on the hip, I believe there must be some inflammation and maybe some wear and tear inside the hip. Okay. So I think the best way to prevent deterioration, like I mentioned, is to lose weight. Because when we lose weight, we reduce the stress over the hip joint. I mean, we reduce the wear and tear every time we walk. Every step we walk is actually quite stressful if you're big size. So weight reduction is really important for joint health.
So can I increase the muscle then? If I find is it easier to increase muscle than to lose weight?
So I think you should do both. I think it's a multi-pronged approach. I think losing weight is important firstly. And what I was going to say, physiotherapy and strengthening. If you strengthen the hip joint, you strengthen the knee joint, it becomes stable. So there's less micromotion, less friction, less erosion, less damage. Okay. And my third point is if you're a smoker, you also have to cut down smoking because it's not good for the cartilage.
Yeah, terrible. All the smokers. Okay. Liner Chung asks, I hear that running is bad for people above 40, especially for the knees. Is there a way to minimize or build strength around it? That means don't run or strengthen your knee for running.
That's a question I can relate to because I'm above 40 and I'm doing running. Then I realized that the knee is really damaged. So I think it's a balance. So everything is done in moderation. Okay?
Yes.
So I like to run 10 kilometers. I run 10 kilometers and run 10 kilometers. Oh, I realized that by 7 kilometers, my knee really burned. It started to hurt. So now I moderate a bit.
Can you change the after 7 and start walking for the last 3? Would that help?
Possible. It will help as well.
Yeah.
So instead of running 10 kilometers at one go, I run 5 kilometers, but I increase the frequency of running.
Oh, that means let your leg rest lah. Then in that way, you still build your muscles lah, is it?
Correct. Instead of running 3 times a week, I need to run 5 times, 6 times a week to make up the distance. If that's what you're gunning for, and I think a good pair of shoes is essential. A good pair of shoes is essential.
I think so essential, right? For your feet as well.
Correct. So I mean, I don't endorse any brand, but you just buy one of the recognized brand with a nice heel because every steps you land on the floor when you run is impact to the knee or to the hip or to the ankle. So why not let the shoe take the impact?
I have a last question for Dr. Lim. What is your key takeaway for our audience and friends here from In Conversation, brought to you by Pulse Prudential?
So I think the key message is to understand the condition really well. Okay, both knee arthritis and frozen shoulder. And to get a correct diagnosis, I always tell the patient, if you don't get a correct diagnosis, example, a knee pain that's not due to the knee but due to the hip, whatever treatment, whatever physio, whatever medication you place on your knee is going to be useless because
you also mentioned some causes are because of other body illness like nerve or cancerous stuff or whatever. Right?
Yes, correct. So diagnosis is important. I think the take-home message is to get a correct diagnosis. Then you invest your time and resources on treating it. Otherwise, you're wasting time and resources.
And also take care of your joints and your bones when you are younger. Right?
Yes.
Okay, thank you so much, Dr. Lim. We can't have enough of you. And I don't know about the rest of you. I'm booking my appointment with you next week already. So be ready to free your time, Dr. Lim, for the next week for all of us here. We have so many patients who's going to knock on your door. And
see all of you. Thank you.
Thank you so much. Take care. We don't hold you up anymore. I know you have patients waiting to attend to. Okay? Bye-bye.
Thank you, everyone. Bye-bye.
Thank you. Bye-bye.